So welcome to session number 1. My name is Alexa, and I will be helping Jay Schenirer with addressing Q&A questions in the chat. We will hold a Q&A if we have time at the end of the presentation for about 5 minutes. Please use the chat function to ask questions, but if you'd like to unmute yourself and ask during the session, you are welcome to do so. Just you will be recorded if that happens. So if you realize that you're in the wrong room right now, please confirm that your name reflects the room that you want to be in and return to the main room, and you can be shuttled to wherever you'd like to be. So without further ado, I'm going to introduce Jay Schenirer as a council member of the Sacramento City Council representing District 5 in California. He has experience working as a consultant and policy advisor on education and youth policies, and also exemplifies dedication to the Sacramento community in several roles, including Assistant Secretary for Education for Development and Planning, as the Deputy Director for the Foundation Consortium for the California's Children and Youth, and as the General Manager of the Sacramento Food Bank and member of Board of Trustees of the Sacramento Unified School District. Thank you, Jay Schenirer, and the floor is yours.
Thanks very much. I really appreciate it, and I appreciate being here today. Tell me what time we're ending. Are you adjusting that as well, or just so I can?
Yes, we will plan to end at 11:30. Does that sound good, Angela?
Great.
Actually, yeah, so 11:25, we might try to open up the Q&A and then end by 11:30.
Okay, actually, what I'd like to do a little bit, I don't want to disrupt anything here, but when you all came to me to do this and said 25 minutes of speaking and 5 minutes of Q&A, I almost want to flip that on its head. I'd like this to be much more of a conversation. We have a relatively small number of folks, so I'll probably talk maybe 10 or 15 minutes and then just open it up. And yeah, I can do it from the participant list if people want to raise their hands, or you can do it however this works.
Perfect. We can have it be a casual.
Okay. And so these are very informal for me. Again, much better to have the conversation and for me to talk about what you want to hear or get answers to, rather than me spouting off better pedagogy in any way we look at it. What I'd like to start off with, and since we only have about 20 folks in the room or in the Zoom room here, could we do some quick introductions just so I know who you are? Just give me, name and what you're doing would be great. And Alexa or Angela, do you want to call people's names, or do you want me to do it? Just make it easy.
I can start so we can facilitate it on, and maybe after you introduce yourself, if you can just popcorn to another person that hasn't gone yet so we can keep moving. So my name's Alexa. I'm a second-year medical student at the UC Davis School of Medicine, and I'll popcorn to Dr. Tan.
Hi, I'm Henry Tan, Associate Vice Chancellor for Health Equity, Diversity, Inclusion, and I'll popcorn it to Laura Grant.
Hi, my name is Laura, and I studied global disease biology at UC Davis, and I'm currently a nursing student with Samuel Merritt University.
And why don't we go to Mara?
Good morning, my name is Maura, and I am a third-year PhD student in the School of Nursing. And we'll go to Annette.
Hi, my name is Annette. I'm currently an MS1 at the UC Davis School of Medicine, and I'll popcorn to Dr. Henderson.
Thank you, Annette. Mark Henderson, I'm the Associate Dean for Admissions and Outreach at UC Davis, and I will pass this to Dr. Fancher. I think we've done a lot of work together in the South Sacramento community to build programs for our students, so I hope he talks about that.
Nice little tee up. Hi, I'm Tanya Fancher. I'm Associate Dean for Workforce Innovation. Super happy to be here. And I'm going to toss it to Ren.
Hey y'all, my name's Ren. My pronouns are they, them, and I'm a second-year med student at UC Davis. And it's cool to see some of my mentors in here. It's really, y'all are awesome. And I'm going to popcorn it over to Veronica.
Hi, I'm Veronica. I'm a second-year medical student here at School of Medicine, UC Davis. And I will popcorn it over to Brent.
Hi, my name is Brent Liu. I'm a faculty at School of Nursing. Yeah, first time to be here. I'm glad to be here. And I'm gonna popcorn to Kim.
Hi, my name is Kim. I'm a Sac State grad student as a MSW, so it's kind of funny seeing a lot of medical students, and I'm a social worker. So yeah, I'll toss this to Shanna.
Hi, this is Shanna Regenberg, and I'm the director of the MEPN program at UC Davis School of Nursing. Glad to be here, and it's been inspiring so far. And if Dr. Adams hasn't spoken yet, I'll pass it on to her.
Thank you. Dr. Susan Adams. I'm on faculty in the School of Nursing, but I also teach in the School of Medicine, and women's health nurse practitioner and a recovering politician. And I will pop it over to, did Charles speak yet?
Thank you. Good morning, everyone. My name is Charles Udeza. I'm a special projects coordinator for reInvent South Stockton Coalition. And I'll pass the mic over to Graciela Lopez.
Graciela? Okay.
If you're having trouble unmuting, we can maybe move on. Has anyone else not introduced themselves yet in this room?
I can go. Hi, everyone. My name is Carmen. I'm currently in my gap year working as an ENT medical assistant. I'm currently applying for medical school, and it's very nice to meet all of you.
I think Annette.
Oh, I've gone already.
Oh, sorry. And Joseph.
No problem.
I'm happy to go next. Hi, everyone. It's so nice to see all of you here. My name is Angela. I'm a second-year medical student, and I'm here recording the session for us. So it's really nice to have you all here. And I believe Joseph Kim, if you would like to introduce yourself.
Sure. Yeah, my name's Joe. I'm a fourth-year internal medicine and psychiatry training program resident, and I think the last person was the 530****717.
Okay, well, seems to be having some trouble there. So let's go ahead and do this. And if you haven't introduced yourself, you can certainly interrupt me at any time. So as you know, I'm Jay Schenirer. I'm on the City Council. I've been on the council for a little under 10 years now. I'm in my third term. I represent about 20 different neighborhoods. At the northernmost part of it is Oak Park and Curtis Park, and you can kind of go south along Stockton Boulevard, everything west of Stockton Boulevard until Florin. Go kind of across Florin until you hit Freeport, and then go down to Meadowview Pocket and go over to Highway 5 and then come back up. I have Southland Park, Zebra Park, Hollywood Park, Curtis Park, Mangan Park, most of the parks here in Sacramento. Most of the work I've been doing over the last 10 years is around youth and trying to give youth a real voice in Sacramento. We're making a lot of progress on that, and if people are interested, I'm happy to answer questions on that as we go forward. You know, the pendulum has certainly swung here in Sacramento, like in cities and municipalities across the nation, around the issue of equity. And so what I want to do is maybe talk just for a few minutes really around what the city is doing and what SACOG is doing. You may or may not know that, you know, when you're on the city council, it's not the extent of the meetings you go to. We are also assigned to many boards and commissions. So I serve on the library board. I serve on SACOG, which is the Sacramento Area Council of Governments. I was the chair of that board that represents 28 jurisdictions around the region. I'm on the SETA board, which is a workforce and employment board. And I've got an STA, which is transportation, regional transit, a number of other things. But I'll talk a little bit about what SACOG is doing and then also what the city is doing, and then really open it up to questions or comments that you might have or areas that you'd like to discuss, which I'm more than happy to do. For the city and SACOG, I think we're looking at the question around equity in 3 different levels, and these are not necessarily, they're concurrent, and we need to attack them in all ways. The first is internally. So as an organization, as an institution and a public organization, what do we look like internally, and do we really reflect the community that we represent? This work for the city started a number of years ago when we started looking at those numbers basically, and asked our auditor to do, a city auditor to do an audit of ethnicity and what we look like, and also gender in the city, to see if the folks who work, the thousands of folks who work for the city, adequately reflect the city's population. And what we found is, to no one's surprise, was the answer was absolutely not, and really not even close. Very much overrepresented in Caucasian, and depending on the department, might be overrepresented in males or females. So at the higher levels, overrepresented in men. At a lot of the other levels, overrepresented in women. And so we looked at it department by department. Police and fire, which is the bulk of our money, really. It's probably 2/3 of the money that we spend as a city. Very, very much overrepresented in white males. And so have really been working on that, have decided that we do an annual audit of that and bring that to the council to see what programs and policies our managers are undertaking to correct that situation. And I want to be clear about all of what I'm talking about. There are no silver bullets here, as you all know. And so this will take time to do as we make changes. So that's the first level, is what do we look like in our employment, in our workforce, and is that reflective? Because until we are there, we're not going to be able to serve the population that we are represented to serve adequately, I think. The second level is really about who we do business with. So are we contracting with folks who are representative of the community? Kind of along those lines, where we spend our money as a city, is that coming into the right places? So that's the second level of what we're doing. The third level is really the community itself. And are we working with those communities to make our investments, not just our contractors, but our investments in communities, are they inclusive, and are we looking at it through an equity lens? Those are the three levels. I would say for SACOG, Sacramento Area Council of Governments, it's the same thing. The SACOG staff has been looking at itself over the last year or so to look at, is it representative of the communities it serves? And that's a different community because it's a 6-county region. We have a board that is, when I got on the SACOG board, there are 31 members of the board of SACOG. They're all elected officials. When I started there, out of the 31 electeds representing 28 jurisdictions, there were 3 women. All were actually named Susan. So you not only had to be a woman, you had to be named Susan to be on the board. And then we had, I think, 2 people of color on the entire board. So incredibly white kind of throughout. That's changed a little bit, but we don't have authority really over who is chosen. I'm chosen by the mayor. So myself and Rick Jennings are the 2 representatives from the city of Sacramento. But same thing, looking internally at who we are and what we're doing. Same thing, again, second level is where the investment's going, which is critical. SACOG does, Susans were likely born in the 50s to 60s is probably true. So the second thing is, where do we invest our money? SACOG invests more money in transportation than anything else. That's what they do. A lot of federal funds, a lot of state dollars, and really understanding where that money is going. And the third level on the community piece is a little bit different with SACOG. They have a little less connection to individual communities. So let me go back then for the city, and these things are going on in other organizations throughout the city and the county. For the city, we're coming at it in 2 different ways. The first is, a year and a half ago, we hired a diversity manager, Ami Barnes, in the city, who is wonderful. And she has spent the last year and a half working with Race Forward, if you know that organization, working with a group of individuals as city employees to start to develop the tools that we need to be able to measure what we're doing. What I mean on that is really about looking at our staff, and that's where we're starting, because until we fix the internal challenges, we're not going to get to a lot of the other things. So what Ami did, spent a year and a half. We just had a presentation probably 3 weeks ago at our Law and Legislation Committee, which I chair. Eric Guerra and I, Eric is a council member for the other side of Stockton Boulevard, and we brought Ami to our Law and Legislation Committee, and she did a presentation, which was really the result of 18 months worth of work of moving us forward on this path. And the path to me ends up with a lens of equity in how we do our business. So what that means to me is when we do policy or program or budget, in our staff reports, there's a line that says financial impact to the city. There's no line today that says equity impact to the city. And so what we have to do as a next step is develop that tool so that we can put that lens on every decision we make. I would like to get to a point where we can start with some of our department budgets this year as we do next year's budget. And remember, as you know, I mean, this is all going on in the context of a pandemic. So everything that's happening with our staff is one more level of work that they're doing to try to make it through all this. But we will have hopefully an equity lens that we will use as we develop our budget. And our budget is over $1 billion for the city, about half general funds and half specific funds like solid waste, water, things like that. The other piece from the city, which I think is equally important and goes in line with what I was talking about before, where we make our investments in the community, is that when we passed our second half-cent sales tax, Measure U, what we said, and this was led by the mayor, was that of that money, we passed a cent sales tax, a half a cent continuing, and a new half cent. The new half cent would be for inclusive economic development. You know, we hit COVID, and this has been a real challenge. We've had a lot of, I would say, problems in implementation of this, but I expect that hopefully next year and following we'll get back to it. And we passed the city resolution that says $40 million a year minimum will go into inclusive economic development. So namely that it will go to neighborhoods that are most at risk, that have the most challenges. We have also included that in Measure A, which is on the ballot in 34 days or so here. Some people refer to it as strong mayor. There's multiple components to it. One is changing the form of the structure of government that we have in Sacramento, but then a lot of other pieces, including this $40 million minimum that would be allocated to inclusive economic development. And what I did as we were having that discussion was passed with support of the council that 25% of that 40 million or 10 million would be reserved for programs for young people. So I'm excited about that. So from the city, we're working at it from our own bureaucracy. How do we change that? And then I think from the political end of how do we make these investments where we think that they should go. The example that's working on SACOG and SACOG's equity committee is much more recent. But as we just looked at the formulas that will be giving out transportation dollars, which total about $200 million every 2 years, what we did do is put aside $3 million, and that will go to planning grants for all of our jurisdictions for at-risk communities within their jurisdiction. So what we found is in getting proposals from the communities, there were communities that, and primarily communities of color, that didn't have the wherewithal to write the proposals at a level that they could be funded. And so if we're going to start making investments for transportation in communities that are most at risk, we need to have a good bench of proposals. So what we did is put some money there so that we could start that process. And then we're starting to look at all the other components of equity within SACOG. So let me stop there. Those are two examples. They take taking a lot of bandwidth on both the city work and the SACOG work, well worthwhile. But no one should underestimate the investment that it takes to be able to do this work in an organization, particularly a bureaucracy, that you're trying to bring reform or change the direction of that bureaucracy. So I'm going to go ahead and stop and see if there are other things that you want to talk about. We could talk about Aggie Square. We could talk about anything that you have questions of. I will either answer you directly or make something up.
Yeah, thanks, Jay. I have a question. Can I jump in, Alexa, or not? I don't want to take away your moderatorness.
Go for it. We have about, you can take any of it away if you would like to, or use whatever power. We have about 8 minutes left in the session. So if we want to be informal and everyone just pop in and ask your questions, go for it. So take it away, Dr. Henderson.
I think I love, Jay, the focus on equity, but also on the representation question you alluded to with respect to racial and ethnic representation. Again, our representation of the population served in the district. We've adopted a similar approach at the medical school because we feel it's critical to actually deliver on our mission to care, to meet society's needs from a healthcare perspective. We have to change who goes into medical school and who graduates to care for these people. I guess my question is, what do you hear from your constituents about what UC Davis can do to improve equity or to help, help with that really important critical problem now?
Yeah, so that's a great question, and if you don't mind, I'll be blunt so I can get myself into trouble because I'm not running for another term, so I don't really care anymore. We're currently negotiating with UC Davis and with Wexford about Aggie Square. Some of the items that we're talking about and having really serious discussions about, and I'm encouraged by the response of both the organizations, are a number of things. One, having a project labor agreement, similar to what we did with Golden One, that would require apprenticeships and pre-apprenticeships from the neighborhoods around the university. So what's happening there? We're also beginning a discussion around local hire, and frankly, what percentage of the hospital systems in Aggie Square should also come from specific neighborhoods, specific zip codes. And then there's a lot of discussion around what else might go into a community benefit agreement and how do we do affordable housing. If you all being UC Davis and Wexford are bringing 5,000 to 10,000 new people there, we need to protect the neighborhoods so that folks in Oak Park particularly are not displaced because we have others coming in and rents going up, ridiculous amounts, because we want to redo Stockton Boulevard, but we need to do that. I think what UC Davis has suffered from, honestly, is a lack of trust, because they've been really an institution unto themselves for the most part. There are examples we can give. And so I think that there's a real desire for change. I think your chancellor is great in wanting to make Aggie Square and UC Davis more part of the community. So moving on a lot of those items, and there's a lot of low-hanging fruit there, doing health screenings, doing job fairs. There's a lot of things that we could do that I think would help the situation, many of which are very low cost or no cost. It's just how we do business. And I understand, UC Davis is a huge bureaucracy, and it's hard to move the city. UC Davis is twice as large as we are as a city, and so it's going to be difficult, but lots that we can do.
Thanks. I think you're right about the bureaucracy and the slow pace of change. So maybe this conversation could be a way to maybe, I don't want to call it accelerate, but anything would help. in my view. So I know there are a lot of other questions.
Yeah, again, it goes back to that potential opportunity that we have right now. We could do it well, or we could really screw it up, to be honest. Yeah. So there's a question here about policing in Sacramento. What we have done with policing, and I think we have a great police chief, Daniel Hahn, who comes from Oak Park and is working hard to change the culture within the police department. Again, not an easy thing. But what we have done is we are looking at the services that are provided and the phone calls that we get to the police department and asking the question about whether or not those services should be accomplished by the police department. We have also started the Office of Community Response. We have a social worker, Bridget Dean, who is running that department. And the idea is over the next 6 months to 2 years, take the things that we don't think the police are best at and move them over into this Office of Community Response. We've done 2 things thus far. One is all of our homeless division, and we become, for better or worse, and this is not a usual city role, we become a social service agency because of the homeless issue primarily. But we've taken all of our homeless services and moved them over. So the calls will not go to the police anymore. They'll go to this new office, which will have social workers. Kim, you should come and apply. But we'll have social workers who will respond to calls around homelessness. That is not something that the police signed up for, and not something that they have the requisite skills for. We've also moved our Office of Violence Prevention over there as well. We think the gang issues, not necessarily police first, but again, looking at social workers' mental health issues. So what we're doing is piece by piece, we'll look at what we want to move over. That will be based on the data that we have on where calls come in and what we can move over. And that will be followed by the dollars to come out of the police department to fund those services in this Office of Community Responsibility. So we're trying to be thoughtful about it and do it incrementally. We don't want to do something that will cause wholesale folks to leave the police department, because also what happens then is the ones who are left are not necessarily the ones you want. There's a question here, whoops, it changed. I don't know, does someone, do you want me to read it, or do you wanna, how do you wanna do this?
We have about 2 minutes left for the session. So whichever question you'd like to address. I think Tanya Fancher and Carmen Ma have a related question. It's about considering expanding healthcare services.
Yeah.
Yeah, that was my question, Jay. I think that, you know, we're in the business of providing healthcare. So I just wonder what the conversations are around expanding the provision of healthcare to the neighborhood.
Yeah, you know, that's a tough one because, again, it's really the county's responsibility, and I don't want to deflect from the city, but the funding streams that come from the state and the federal government around health go to the county. Their budget is 3 times as large as ours. We have delved into the homeless situation because we've had to. We have gone into the mental health situation for young people. We did a number of things out of our CARES money to provide mental health, mostly peer-to-peer in our high schools. So we're doing that. But as far as straight out kind of health, it's just not something we do. And I don't want to recreate the wheel. We don't have the capacity or resources to build that. We'll work with anyone we can. And I assume we'll dip our toe into some of these things, but generally it's going to be a county responsibility.
Hi, everyone. How was your first session?
Excellent.
Excellent. It ended too quick.
I know, we just got cut off in the middle. It was
Yeah, we were right in the middle of a good
question.
Well,
now we're back in the big Zoom room again.
yeah, so we're all back. Well, we'd love to continue this conversation. We'll create some kind of chat that we can keep talking after this conference. We'd like to give everyone a bio break, a coffee break, a snack break. Make sure you stretch. And Melissa will go over again how to change your room for session 2.
Everyone, welcome back. So we'll be doing the same thing as we did for session 1. We'll be taking your break once you move into the session, the breakout room. So go ahead and rechange your name. Same way, you go to the bottom of your Zoom screen, press participants, click more, click rename. And this time, room 5 is Dr. Kasiri, room 6 is Dr. Ian Kim and Dr. Colleen Sweeney, room 7 is Aaron King, and room 8 is a SAC covered group, and the speaker's name is Maritza. So go ahead and change your names and we'll move you in a bit. If you're having trouble changing your name, just go ahead and put in the chat what room number you want to be in, and we'll change it for you. And only put one number, and that number should be in front of the name.